My name is Terry Finnerty. I'm a public health nurse, and I want to support this motion. Since it's been outsourced, communication is very, very difficult. It's all third party, and mostly they want emails now. So if we're out in a patient's home and something happens, we can't get there. The outsourcing of the home help means that they email their bosses, who in then turn email the HSE home help organiser, who then emails us. So we mightn't hear about this for hours if there's a problem with a patient, a nursing problem. And it's a big disadvantage to the patients that they may not know who they're getting every day. There's no continuity. We can't communicate directly with the home help service now if they're outsourced, because we don't know who they are. And I want to support the motion.
Great to be back. Sandra Morton, Operating Department Nurses Section. The last motion is very important as well as this one, but one word that we're totally missing, and we know it this week in Ireland as women, is governance. There's no governance in the HSE, and I think it's very, very clear. In theatre, obviously, we're dealing with these patients by the time they come to theatre, and we're very well aware of the issues that the patients face, but that they are treated worse than cattle in cattle marts. We try our very best with them, but I really feel that it's important that we support this motion to ensure that the elderly are properly looked after in our society. I have had a relative die in the last 6 months in another jurisdiction who also hasn't had the care that she should have had offered to her as an operating theatre nurse, and it's very hard to stand by and see that, because she was somebody who looked after many people who died themselves, and it's something that's very important. And if we don't stand up for these people today, what kind of a society are we? What are nurses and midwives of this country if we can't do that? We're nothing, and we are the only thing that's stopping death in this country, because it isn't a manager in the HSE, it's no administrator. And I think that message has to go back very clearly to Tony O'Brien today over these issues, because we have had enough. We can neither recruit nor retain nurses in this service, and if we can't speak passionately about the care that we need to give to those patients, we are on a hiding to nothing. Thank you very much.
The problem with the agencies at the moment is they're paying minimum wage to staff. They don't pay them for their travel time. So the staff that they're recruiting are barely getting from house to house. They get paid for their 30 minutes. I just want to tell you a little tiny thing that happened to me Christmas week. 2 things happened actually. So I called to a house, Stephen's Day, knocked on the door. Was meant to meet a carer there, a very frail lady, bedridden, pressure sore, needed to be dressed. So nobody answered the door. So I thought, I better wait, I'll give the girl a few minutes, she's obviously busy. So I waited. So anyway, nobody came. So I rang the agency phone number, and she said, she's in the house, she's logged in. So I said, well, I'm knocking on the door. Oh, no, she's definitely in the house, she's logged in. So I went back to the door, knocked on the door, stayed on the phone. So she said, oh no, she's definitely in the house. Well, I said, I'm at the door. And I said, well, maybe there's something after happening her. So I thought, I'll wait another few minutes. No sign of anybody. So off I went to do my other calls. I said, I'll call back. So when I came back, the agency were still adamant there was somebody in the house. There was nobody in the house. 2 days later, called to another house, different agency. Called in, the gentleman, 89 years of age, lives alone, no family, diabetic. He said to me, Gráinne, nobody came last night. So I said, okay, and she's not here this morning. I said, I'll make you your breakfast and give you your insulin. Called the agency. Oh no, she's in the house. I said, I'm sitting in the kitchen, she's not in the house. Oh no, she's definitely in the house, she's logged in. So that's what we're talking about when we're talking about privatisation. That's what happens. Now, when the carer did arrive, what had happened was, because she's not getting paid between her calls, they're logging in another house, and then they're driving to the next house. Now, these are people who are the lowest paid in the country. That they're not being treated well either. Yeah. But, that's what you get when you privatise things. You refuse to pay for a good service. But who suffers? The 89-year-old diabetic in the home. Please support this motion.